Hello, welcome to my YouTube channel. This is the second video of my YouTube channel. In this video, I will guide you how US health insurance works. Basically, healthcare in the United States can be very expensive. A single doctor office visit may cost several $100 and an average 3-day hospital stay can run ten of thousands of dollars or even more, depending on the type of care provided. Most of us could not afford to pay such large sums if we get sick, especially since we don't know when we might become ill or injured or how much care we might need. Health insurance offers a way to reduce such costs to more reasonable amounts. Most important thing is that the way it typically works in that consumer you pay an upfront premium to health insurance company and that payments allow you to share risk with lot of other people who are making single payments. Since most people are healthy, most of the time the premium dollar paid to the insurance company can be used to cover the expense of relatively small number of enrolls who get sick or are injured. Basically, insurance companies, as you know, can imagine, have studied risk extensively, and their goal is to collect enough premium to cover medical costs of the enrolls. There are many different types of health insurance plans in the US and many different rules and agreements regarding care. Following are the three important questions you should ask when making a decision about the health insurance that will work best for you. Number one key question is this: where can I receive care? One way that health insurance plans control their cost is to influence access to providers. Providers include hospital, laboratories, pharmacies, and other entities. Many insurance companies contract with a specified network to provide that has agreed to supply services to plan enrolls at more favorable pricing. If a provider is not in a plan network, the insurance company may not pay for the services provided or may pay a smaller portion than it would for in-network care. Basically, this means the enroll who goes outside of the network for care may be required to bear such higher share of the cost. This is an important concept to understand, especially if you are not originally from the local Stanford area. If you have a plan through a parent, for example, and that plan's network is in your hometown, you may not be able to get the care you need in the Stanford area, or you may incur much higher cost to get that care. So now move to the second key question, which is very important. What does the plan cover? Basically, one of the main things health care reform has done in the United States under the Affordable Care Act is to introduce more standardization to insurance plan benefit. Before such standardization, the benefit offer varied from plan to plan. For example, some plans covered prescription, other plans did not cover. Now, the plans in the United States are required to offer a number of essential health benefits which include emergency services, hospitalization, laboratory tests, maternity and newborn care, mental health and substance abuse treatment, outpatient care, doctors and other services you receive outside of the hospital, including dental and vision care, drugs, preventive services, for example, some immunization and management of diseases. For our international population of students who might be considering coverage through a non-US based plan, asking the question, what does the plan cover is extremely important. So now move to the third key question, which is more and more important and everyone wants to know how much it will cost. Basically, the main understanding thing is that what insurance coverage cost is actually quite complicated. In our overview, we talk about paying a premium to enroll in a plan. This is an upfront cost that is transparent to you. For example, you know how much you can pay. Unfortunately, for most plans, this is not the only cost associated with the care and receive. There is also typically cost when you access care. Such cost is captured as diabetes, and our copies see definitions below and representative. The share you may pay out of your own pocket when you receive care. As a general rule of thumb, the more you can pay in premium upfront, the less you will pay when you access care. The less you pay in premium, the more you will pay when you access care. The question of our student is pay a larger share now or pay a larger share later. Either way, you will pay the cost of care you receive. We have taken the approach that it is better to weigh the larger share in the upfront premium to minimize as much as possible costs that are interrupted at the time of the service. The reason of our thinking is that we don't want any barrier to care such as high copy at the time of service is to discourage students from getting care. We want students to access medical care whenever it needed. Now, move to the second part of this video. Most important insurance terms and concept. Out of pocket expensive. And the term which is used for the out-of-the-pocket costs that are not cost-sharing, refer to the portion of your medical expense you are responsible for paying when you actually receive health care. The monthly premium you pay for care is separate from this cost. Annual dedicable. The annual dedicatable is amount you pay each plan share before the insurance company start paying its share of the cost. Its deductible is $2,000. Then you would be responsible for paying the first $2,000 in healthcare and you will receive each year after which the insurance company will start paying its shares. Now, move to the co-payment. Basically, the co-payment is a fixed upfront amount you pay each time you receive care when that care is subjected to a co-payment. For example, a co-payment of $30 might be applicable for a doctor visit after which the insurance company picks up the rest. Plans with higher premium generally have lower co-pays and vice versa. Plans that don't have co-payments typically use other methods of cost sharing. So now move to the another part, co-insurance. Basically, co-insurance is the percentage of the cost of your medical care. For an MRI that costs $1,000, you might pay 20%. For example, $200. Your insurance company will pay the other 80%, which was around $800. Plans with higher premium typically have less co-insurance. Annual out-of-the-pocket maximum. The annual out-of-the-pocket maximum is the most cost sharing you will be responsible for in a 1 year. It is the total of your deductible, co-payments and co-insurance, but does not include your premium. This is the most important thing to understand. I am repeating again. Annual out-of-pocket maximum is a total of your deductible, co-payments and co-insurance but does not include your premiums. Once you hit this limit, for example, if you touch the limit, the insurance company will pick up 100% of your covered cost for the remainder of your plan per year. Most enrolls never reach the out-of-pocket limit, but it can happen if a lot of costly treatment or a serious accident or illness is needed. Plans with higher premium generally have low out-of-pocket limits. What it means to be a covered benefit. The term which is used for covered benefit and covered are used regularly in the insurance industry but can be confusing. A covered benefit generally refers to a health services that is included, for example, covered under the premium for a given health insurance policy that is paid by or on the behalf of the enrolled patient. Covered means that some portion of your allowable cost of a health services will be considered for payment by the insurance company. It does not mean that the services will be paid at 100%. For example, in a plan under which urgent care is covered, a co-payment might apply. The co-payment and out-of-the-pocket expenses for the patient. If the co-payment is $100, the patient has to pay this amount, usually at the time of the service. and then the insurance plan covers the rest of the allowed cost for the urgent care service. In some instances, an insurance company might not pay anything toward a covered benefit. For example, if a patient has not yet made an annual deductible of $1,000 and the cost of covered health insurance provided is $400, the patient will need to pay the $400 often at the time of services. What makes these services covered is that the cost counts toward the annual deductible, so only $600 would remain to be paid by the patient for future services before the insurance company start to pay its shares. Basically, this is a main motto of the video how health insurance works in United States. Thanks for watching this video. If you like this video, please press the bell icon and thumbs up the like button. Thank you.